Welcome back. Let's zone in on the Free State Province now. Well, the health department is quite concerned about a drop in the number of people registering for COVID-19 vaccines. It seems at this point the province has not reached half of its target to vaccinate 1.9 million people, at least to reach herd immunity. Now, it seems also at the same time, schools in the province are experiencing an increase in infections. We've had this conversation on eNCA quite widely. So what are they doing about this? Let's speak now to Godfrey Mahlatsi, who's the acting HOD at the Free State Health Department, and he joins me now for this conversation. Mr. Mahlatsi, good to have you, and good morning to you. But it seems that you do have challenges on your plate and on your table as the Health Department. One of them being that it seems that the turnout in terms of registrations is quite low, lower than anticipated. What do you think you could attribute this to?
Thank you, Tumelo. We basically attribute the poor attendance to our vaccination sites due to the harsh weather conditions, but also obviously there are certain people who still have got their own doubts. We thought that perhaps what we need to do is to reach out and make sure that at least we send out foot soldiers that would encourage people to register and also show them the importance of registering and deal with the fears, obviously. And we are basically reaching out through partnerships with GCIS and UNICEF. They basically assisting us with their trucks. We are moving around across the province to campaign for people to come and register. We are also reaching out to the farms in the peripheries. We visited our old age homes and vaccinated people out there. And we are also planning to already implement the third phase, where we would be vaccinating the teachers. We are targeting about 27,000 teachers in the province. And but this will be dependent on the availability of the J&J vaccine.
Right. It seems you have a multidisciplinary strategy in place to ensure that you intensify your campaign here, Mr. Mahlatsi. But I just want to touch on, your targets. I know that you're targeted 1.9 million people at least to reach herd immunity within the province. Where are you right now?
At this point in time, we have already vaccinated 94,000 people. We have about 113 registrations. During the first phase, we vaccinated 24,000 people, and currently we are at 70,000 of the second phase. And we are confident that through these other initiatives of reaching out, would be able to move with speed and make sure that we catch up in terms of ensuring that we reach that herd immunity as quick as possible.
Quite disappointingly for the province, I mean, it seems at least daily or so, you're seeing less than 500 people coming in to, vaccinate, or at least register to vaccinate. Your target had been 200,000, particularly in the second phase. And I want to touch on awareness programs as well as communication campaign strategies, because I read in a report that while the MEC of Health, that's Manseng, of course, who was at the Maokeng Mall in Kroonstad. One of the elderly had said that, listen, I've heard about COVID. I'm not sure what it is, but I'm doing what everybody's doing, which is just to vaccinate. How are you planning then to intensify the communication and the awareness programs to ensure that people do understand what COVID is? They do, register to vaccinate from a point of understanding, but also ensuring that communication there is on point and effective.
Yes, we are focusing basically on this time around going out to people. We are reaching out, and we have procured a number of the gadgets that will be utilized by our own community health workers, who would be going out to visit people in their own homes, at the comfort of their own homes, to explain the importance and the the outreach that MEC is doing in towns is also assisting a lot. We've had similar challenges in the Harip area, but subsequent to the visit in Harip, we started seeing numbers going up. So we believe that our outreach program is working, and also that unfortunately for the past week, the weather conditions were just too unfavorable for us, hence the numbers started going down.
And just lastly, before I let you go then, Mr. Mahlatsi, I mean, looking at the facts here, from at least the 12th of June 2021, the province is the fifth highest, just in terms of those infection rates, and over 160,000 cases you've seen, so including over, just 400 fatalities due to COVID-19. Is the health, department, particularly when you look at, healthcare infrastructure, facilities, ambulances, are they well equipped, especially with fears amidst this third wave, which is also seemingly ravishing, just in terms of infections at schools? Are you well equipped in terms of bed capacity, making sure that healthcare professionals are ready for what may come to the province at this time?
Look at if you look at the current statistics of the infections, in fact, you would notice that the province was among the first provinces that entered into the third wave. And if you look at the current figures now, Free State is actually going down. This is basically due to the interventions that we have in the province. We are appointing a number of vaccinators. We are appointing a number of people who are assisting us with tracing, so that we are able to determine where are the biggest problems within the province, and directly address those problems. And we are also building capacity in terms of the beds. We have one hospital that we have put aside in Harip, the Alfred Nzula Hospital, that we have just put it aside for the beds in the event that it happens that the numbers increases. But we are confident with the current interventions that our numbers are in the decline, and we'll keep them as such.
All right, so we'll leave it then. Godfrey Mahlatsi, of course, the acting HOD at the Free State Department of Health. Thank you so much for your